Hey guys, what's going on? Welcome to this Medicare Minute. Now in this video, I'm going to answer the question, what are my options for submitting Medicare claims if I'm a small provider? And those words, small provider, are really important in this scenario. So most of you are familiar with electronic claim submission, EDI. We've talked about clearinghouses and electronic or accounting software, and basically what all goes into submitting claims electronically. But a lot of you guys are just starting out. You're not seeing huge volumes of patients. You're not even hiring staff yet. You're a one-person show. Do you need to submit claims electronically? Do you need to pay Office Ally $35 a month? What are your options? Let's jump into the Medicare literature and let me show you what you can do. Okay, so here we are on the Noridian website. I pulled up two resources. I'm looking at Palmetto GBA and Noridian. These are two MACs. They cover a bunch of states, and they basically have the same guidelines, and that's why I'm using these two. If you scroll down under mandatory claim submission, and we look at the information here on paper claims. Nobody discusses paper claims, but I think it's a viable option if you're just getting started and you don't want to incur any extra costs. So let's take a look at this. Medicare Part B, I'm going to zoom in here so you guys get a better view. Medicare Part B paper claims may be filed using only the red printed CMS 1500 from August 2005 claim form. Okay, so where can you get this claim form? They are pre-printed claim forms. I'll post my affiliate link in the comments below, but basically if you go to Amazon CMS 1500 and you do a quick search, you'll find multiple, you'll find multiple resources here for various quantities. But I just want you to see, so like 2,500 sheets, $50 almost. Then you can go down to 500 sheets for about $17. You know, if you're just getting started, 500 sheets, you could put 2 or 3 dates of service on a single sheet. It's going to get you pretty far. You don't have to go with 2,500 or more. And for $17, it's certainly not going to break the bank. So Amazon is usually where I purchase my CMS 1500s for when we're submitting paper claims to other payers. We submit to Medicare electronically, but this is a great resource. Again, that link is going to be in the description of this video. And so what you're looking for is, this form is appropriate for filing all types of health claims, health insurance claims, to private insurers as well as government programs. For those of you who are billing out of network or issuing a super bill to your clients, I really encourage you to develop a system that allows you to submit or give them a printed CMS 1500. It's the universal form, it's the gold standard. If you want your clients to have the best chance of getting reimbursed, this is the way to do it. So get comfortable using this form. And so the time frame requirement for payment of paper claims is substantially longer than for electronic claim submission. A clean claim on paper may be paid as soon as 29 days after the date the claim is received, whereas the electronic claim may be paid as soon as 13 days. So you're going to have a little quicker turnover time if you're doing electronic, but again, if you're not in a rush to collect that payment, I don't think it really makes that much of a difference. The claim forms are available on single sheet or 2-part snap out, 1-part continuous. You guys are going to use single sheet. You're just printing on a standard printer. The Mac doesn't supply the forms. You have to buy them, and that's where I showed you from Amazon. Let's take a look at see the mailing address webpage. So I'm going to click on that. And in the meantime, let's define what a small practice or provider is, because you have to meet the guidelines of being small, classified as small, in order to be eligible to submit a paper claim. So if we jump into the Medicare Claim Processing Manual under section 90.1, small providers, a small provider, I'm just going to skip ahead. from the Social Security Act with fewer than 25 full-time equivalent employees. Now that's not clinicians, that's employees. Or a physician, practitioner, facility, or supplier that is not otherwise a provider under Section 1861 with fewer than 10 full-time employees. Now, most of us watching, we're going to fall into this category, fewer than 10 full-time equivalents. And if you look at the remaining definition and description, you're going to see that if it's just you and a receptionist or a VA, maybe you and another clinician, you're nowhere near the requirements to submit electronic. You are eligible to submit paper claims. Now, you know, pros and cons, you have to weigh that decision for yourself, for your business model, for your practice. Certainly if you're submitting paper claims and receiving paper payments and EOBs, there's far more administrative work. But one of the questions I have that I haven't tested, just because this is all new territory for me, is if you submit a paper claim, are you eligible to receive an electronic remittance advice? That would be a really interesting situation, because I believe at this point, if you submit for your EDI through Office Ally, you essentially would be eligible for a free account through Office Ally. You'd be eligible for a free account with their software called PracticeMate. You would submit your EDI application to your Mac, and you would submit your claims via paper, but you would receive your electronic remits via Office Ally and imported into PracticeMate. So I think there might be a way to kind of navigate the system so that you're not being charged the $35 a month submission fee for those claims, but you may still be eligible to receive the electronic remits and have them auto post into PracticeMate if you're using that as your patient accounting software. So guys, we're looking for somebody to test this system out. I'm going to talk to some of the members that are in or have done the Zero to Paid Medicare billing program to see if you can test this system out for me, and let's see if this works. This could be saving, you know, $35 a month over a 12-month period. It's a significant amount of money for somebody who's just starting up. That $35 could go into Facebook ads, Google AdWords, other areas that doesn't necessarily need to be spent submitting electronic claims. So guys, I hope this content was useful. I'll post the links to all of these pages in the description below. If you haven't subscribed to the video, check it, or to the channel, check it out, subscribe. Your support is appreciated. I'm trying to get to over 1,000 new subscribers this calendar year. That's 2019. In the meantime, if you have questions about anything, post them in the comments on YouTube. This way I can respond to you and we can start the communication that way. But otherwise, guys, I'll catch you in the next video. Thanks for watching.